I'll just say welcome to everybody and thank you to Megan for organising. Somebody else just popping in. I'm Julian Knight. I'm the press and community outreach manager for Lyme Disease UK, and I'm also a trustee of the charity. I have a nursing background. I was a senior nurse before I contracted Lyme disease. So that's my background. So I'll just go into my PowerPoint because I think we're all here. I'll keep an eye out for anybody else. If you just give me a minute just to share my PowerPoint. So hopefully everybody can see that. Everybody nod if they can.
Yeah. Yes, can see it.
Okay, thanks. So yeah, so I've said who I am. Every year we have a big campaign in May for the whole of May called Wake Up To Lyme. But I do these talks all year round because it's really important to get across the message that this is a preventable disease with the right knowledge. I think it's really important to keep that in mind, and it's not about people not enjoying the countryside and not wanting to go into the countryside. The whole point is to use the countryside safely, and with a little bit of knowledge you can prevent this disease. If you happen to contract it, the other point of this talk is to know how to recognise it and how to get advice. So what is Lyme disease? So Lyme disease is a bacterial infection. It's not a virus, it's a bacterial infection, and it's caused by a very peculiar bacteria with a corkscrew shape called Borrelia. It's transmitted via a tick bite, but the tick has to be infected with that bacteria. And it's good to keep in mind that not all ticks carry the bacteria. It's estimated between 10 to 20% in the UK carry the bacteria, but because they haven't got a label on them saying I'm not infected, the best thing to do is prevent a tick bite if you can. So Lyme disease is the most well-known infection that a tick can pass on, but they can also transmit something called anaplasma, babesia, which we get in animals, cattle. So we've had a few infections, very small amount of infections of babesia so far in the UK. And some of you might have heard of something called tick-borne encephalitis, which is not a bacterial infection, it's a viral infection. It's very common in certain parts of Europe. So if you're going to those certain parts of Europe, easy to look up, mainly Eastern Europe, there is a vaccine for tick-borne encephalitis. We have discovered that there are a few ticks have been discovered in the UK carrying TBE. So that's something we have to keep in mind, you know, for the future. Is this going to increase? But there is a vaccine for TBE. There's not a vaccine for Lyme disease. So the reason people often don't spot a tick is because at certain times of the year, they can be as small as a poppy seed. They are part of the arachnid family, but they're not spiders. They've got 8 legs. So this shows you the life cycle of a tick, and you can see how tiny they are compared to a 5p piece. So when the nymph stage of ticks is seen early spring, early summer, and they are tiny, and people get bitten by nymphs and have no idea they've been bitten. And you're most likely to be infected with Lyme disease by a nymph or by a female tick, adult female. It's quite unusual to be infected by a male tick. So we have to be especially vigilant, especially early in the year. Although, because we've now got climate change, traditionally you would say that ticks were active from early spring to late October. But because we've now got warmer, wetter winters in the UK, they seem to be staying hang on, somebody just coming in, let them in. They seem to be staying active all year round in certain places. So it's not quite true that you only have to be vigilant from spring to late autumn now. It's, it's good to be aware all year round. So ticks, once they brush onto somebody, like to find somewhere nice and warm to embed themselves. They're looking for a blood meal. They have to find a blood meal at certain points in their life cycle. They're not particularly looking for a human. They're looking for anything that's got blood. So this is a good example. This photo has been enlarged loads of times. And this is a tiny child. The mum thought it had a mole behind its ear, and it turned out to be a tick that's fed, embedded and fed. As a tick feeds, it grows. So although it starts off tiny, it grows as it fills with blood, and they can grow to the size of a baked bean, but people still miss them because, as you see, as we go along, they like to find nice warm spots to embed, and the nice warm spots are the spots that you don't always think to look at. So that's a good example. Also here, you can see how tiny that is in a guy's hand. My husband got bitten by a nymph tick in the Highlands, just pre-pandemic, and it was minute, and he thought that he kept staring at him thinking, I haven't got a mole there, and sort of said, can you have a look at this? And I was like, oh, you've got a nymph tick in your leg. They can be tiny. So where are we at risk of Lyme disease? So infected ticks have been found all over the UK now. There are areas of the UK where it's deemed to be higher risk for Lyme disease. So these are the Highlands in Scotland, southeast and southwest England, and the Norfolk-Suffolk border is also seen to be a high risk area, but you can pick up an infected tick anywhere in the UK. So traditionally, we've thought that you'll only find a tick in woodlands and in heathlands, the sort of forests, but they've now been found in urban parks and even some people's gardens if they're a bit overgrown. A good example of the urban park is that the England rugby player Matt Dawson, he was bitten while training in a London park, and if it wasn't for his then wife, it would have been missed because she was German. Germany has a high level of Lyme disease. She recognised the strange rash he had in his back, but he did go to the GP on his wife's insistence, and the GP said to him, can't possibly be, we don't have Lyme disease in London parks. So there's a good tale there. Actually, he ended up with a delayed diagnosis, and as you'll see, a delayed diagnosis can cause other problems. For Matt, it infected his heart and he ended up with surgery, and as far as I know is still on medication, fit and well, but still on medication for his heart. So like I said before, you can be infected in any month now, but most likely spring and summer, but keep in mind about the climate changing. The Big Tick Project was an interesting one. It was done by Bristol University, and Chris Packham was part of this project. So they asked vets all over the country that when a dog was brought into their surgery, for whatever reason, didn't matter what reason they were brought in for, to give it a good check over for ticks, embedded ticks. And when the results came back, they found ticks on 1 in 3 dogs, which the owners were totally unaware of. And of course, dogs can get Lyme disease, and pets can bring in ticks. They won't live in your house for very long, but they can live long enough, if the dog's just come in with one and you sit and cuddle it on the sofa straight away, then that tick could brush off onto you. So really important that pet owners are aware of ticks as well. So this is the whole point of this talk. This is a preventable disease with just a small amount of knowledge, really. Prevention is much better than cure, and I could testify to that because my diagnosis was delayed years, not a few weeks or months, and never actually got 100% well again and never returned to work. So prevention is better than cure. So if you're out and about in the countryside or anywhere you think there might be ticks, long grass, overgrown areas, forest, woodlands, heathlands, if you're a hiker, if you're a camper, all those sort of activities. We know that the British public is famed for, if we get one day of sun, everybody jumps into their shorts and flip-flops. And but if you're doing any sort of activities where you can pick up a tick bite, wear long sleeves and trousers, wear lighter colour clothes because you can spot them easier. If you're going somewhere that you know there might be ticks, tuck your trousers into your socks. That stops them climbing up to find a place to embed. Stick to pathways and avoid long grass, which is not always easy if you're walking a dog, but be aware that if you've been in the long grass with the dog, that you need to check yourself. Do a thorough tick check when you get home and have a shower. If you've got a partner and there are parts of you that you can't see, I've got a screen that shows all the warm places where ticks like to go. Get your partner to have a look in any areas you can't see, because they just love to hide in little warm places. So as we mentioned, the Big Tick Project, it's really important that you get advice from your vets about protecting your pets from tick bites, and check them thoroughly for ticks, particularly in the warmer months. Vets actually have a myriad of information about ticks, and actually our medical profession needs to catch up with the vets. Sounds crazy, but it's true. So here we go. This is where they like to go. So your pet can be anywhere on the pet, but they like to go around the collar area. They often embed there behind the collar. I've seen quite a few photos of dogs with them embedded into their corner of their eyes, and the owners have just thought that they've got a little spot or a wart, and in fact it's an embedded tick. So for adults, all the places that you can think about, between the toes, sock line, behind the knees, the waistline. For all the guys watching, they like to embed in the place that you really wouldn't want a tick to embed, and happens frequently. Do check in that place, around your waistline, inside belly buttons. Sounds awful, but that's where they like to go. It's nice and warm in there. Behind armpits, behind ears, behind elbows. So because children are smaller, they haven't got so far to climb. Often find ticks under the hairline of children that get missed. So it's good to check children's hairline and behind the ears. Ticks can get missed on children, and then they become very unwell, and everybody's confused what's going on, and all of a sudden the parent finds a tick in their hair. Really important to check everywhere. So removing a tick, there's all sorts of wise tales about removing ticks, and I've just about heard them all. So never pull off a tick with your fingers. Normal tweezers, as in like the ones ladies do their eyebrows with, the blunt ended ones, or any other tool not designed for the job. So some of the tales from the countryside talk about smothering the tick in oil or Vaseline, burning it off, you name it, I've heard it. The reason it needs to be removed properly is because if you stress a tick when you're removing it, which if you remove it properly, you won't. If you stress a tick when removing it, it responds by regurgitating the contents of its stomach into your bloodstream. So if that is an infected tick, you've more or less sort of guaranteed an infection. So we have two methods of removing it, and this is all on our website. So carefully use a tick remover tool, which you can buy for £2 or £3 in an outdoor shop, Amazon, places like that. And if you're somebody who regularly goes into places or does activities where you can sustain a tick bite, always have one of these either on you or in your first aid kit. And they're basically like a little fork, a little plastic fork-like thing that you slide under the tick, turn it slightly and pull it upwards. If you haven't got one of those, a pair of very fine nose tweezers, you just grab the tick gently as close to the skin as possible and pull straight up. Both of those methods will remove a tick safely. Some people get really hung up because they've left a little bit of the tick in and go into complete panic mode. There's no need to panic. A tick, despite what people think, does not put its whole head into you. If you magnify a tick, it's got huge mouth parts compared to the rest of its body, and it's the mouth parts that go into your skin. If you don't get a clean removal and leave a bit of the mouth parts in, it doesn't, the body will just get rid of it, just like it will any other foreign body. But you just need to keep an eye around it that you don't get a little localized infection from it, which is not Lyme disease. So if you leave a little piece of the mouth parts in, don't panic, the body will dispel it. There's lots of, well, I wouldn't say research, but there's lots of opinions about how long a tick needs to be in you to pass on an infection. In fact, there is no confirmed time that it needs to be there to pass an infection. So the most important thing to do is remove it as soon as possible. So this is a tick removal tool, and obviously that's the fine tip tweezers. And like I say, you can buy these basically for a couple of quid, and they're really important to keep in your first aid kit. So diagnosing Lyme disease, what are we going to do if we do think we've contracted Lyme disease? So let's give credit to the doctors here. It can be hard to diagnose, and there's many reasons why it can be missed. Tick bites easily missed, as we've already discussed, and are not normally itchy, painful, hot or sore like an infected bite or a itchy mozzie bite. The other thing is ticks are a very clever species. Their saliva contains a sort of local anesthetic property, so you won't feel a tick biting you. Some people, if you see in the media, you'll see Lyme disease linked to a bullseye rash, which we'll go on to. But about 30% of Lyme disease sufferers do not produce a bullseye rash. It would be great if everybody did, because it's a telltale sign. And the bullseye rash is diagnostic for Lyme disease and should be treated straight away without any blood tests or anything. Other symptoms to look out for are, we used to say summer flu because of the time span that ticks were normally active, but flus at times when you wouldn't normally get flu symptoms. But of course, we've now got COVID, we've still got COVID about, and that sort of blurs the issue. There's a screen on our website that compares Lyme disease symptoms and COVID symptoms. So if you're ever concerned, you can always go to our website and look at that, because we do know that early in the pandemic, some Lyme infections were missed because they were assumed to be COVID when we didn't have testing. So flu-like symptoms, headaches, stiff neck is one thing that people complain about, painful neck, fatigue, swollen glands, joint pain that seems to move about. One day you've got a sore knee, one day you've got a sore other joint, and it's very confusing, and it makes you feel as if you're like, well, this can't be happening. Pain can't move about from joint to joint, but it is actually quite a hallmark of some cases of Lyme disease. In children, small children can't often articulate how they feel. So the most obvious thing about children, whatever illness they've got, is their behaviour often changes and they become clingy, irritable, the normal thing that would alert a parent to an illness in their child. But with children with Lyme disease, they become very irritable, very unhappy. They can change their sleep pattern. Their behaviour can be completely opposite of what it normally is. So, in that case, maybe think about Lyme disease. We do have a blood test for Lyme disease, but we can't rule out Lyme disease with the blood test, which is a bit of a conundrum, and one of the reasons why Lyme disease gets missed. And the reason for this is that the blood test is what's known as an antibody test. So all that can tell you is that somebody's immune system has encountered the bacteria that causes Lyme disease. It can't tell you if the disease is active or not. And it can produce false positive results, and it can produce false negative results. It complicates the picture, and this doesn't help misdiagnosis. There are plenty of people trying to find a test that looks for active Lyme infection, a direct test, but we haven't got it yet. Also, if any of you are in this position, you think you might have Lyme disease, you go to your doctor, maybe you've had a tick bite and you're now very unwell. And your doctor says, I'll do a blood test for you. It's good to keep in mind that the blood test is not accurate in the first 4 to 6 weeks after a bite, because it takes the immune system a while to make those antibodies. So if you have a blood test for Lyme disease in the first 4 to 6 weeks after a bite, you're still unwell, the blood test should be repeated to see if you have now made the antibodies. We currently have no Lyme disease specialists in the NHS, and people are sort of passed between infectious diseases, neurologists, depending on the symptoms, rheumatologists, if people get really sore joints, and not always, sometimes even psychologists, because the test is negative, you haven't produced a rash like some people don't, and could you possibly be, could this possibly be all in your head? It happens. So we really do need to move towards specialists in Lyme disease. So this is the rash that some people produce. We reckon about 60% of people produce a rash, and it's very specific for Lyme disease. The three things about a Lyme disease rash: its proper name is called Erythema migrans. Erythema means redness. Migrans means migrating. So an erythema migrans rash is always delayed in appearance. If you get any redness after or itchiness straight after a bite, you've been bitten. That's not erythema migrans. It takes, the earliest it will appear is 3 days after a bite, and it can appear right up to 3 months, which is very confusing because you just don't remember what you were doing 3 months ago. But it has a specific behavior. It's delayed in appearance. It's generally not itchy, painful, hot, like an infected insect bite. And gradually spreads outwards. And I've seen some as big as a side plate. So those 3 factors tell you that this could be erythema migrans. So we've got the proper name, erythema migrans, but they can appear a bit differently. And it's not really good me looking for spreading redness if I've got black or brown skin. They can appear very differently on black or brown skin. And they can produce like a bruise-like appearance and spread outwards. They can be a solid rash. If you see in the media bullseye rash, you often see an image of a perfect bullseye type shape with the middle bit red and some rings around it. Be aware that they don't all look like that. And the 3 things that we mentioned before: delayed in appearance, generally not itchy, painful or hot, and gradually spreading outwards. They're the things that should give you a clue. And hopefully the doctor, taking a good history, would look at those things rather than just looking at a red circular rash. Treating Lyme disease, the most important thing is, if you think you've got Lyme disease, to get some medical advice, because the quicker it's treated, the best, and the best chance of having no long-term symptoms. Plenty of people who have been diagnosed and treated quickly and have got well after the treatment. You sometimes see in the media people like myself who the diagnosis got missed and went on to have like a long-term illness. But the treatment for Lyme disease is antibiotics. As I said before, if you produce a true EM rash, that's diagnostic for Lyme in itself, and treatment should be started straight away without a blood test. Your GP obviously will be able to advise on the antibiotics, but doxycycline is mostly prescribed for adults and amoxicillin for children. The dosages, if there's anybody here with children who finds themselves in this position, the dosages for children for Lyme disease are very high, and sometimes doctors think that can't be right, but it is correct. They are high doses, and we now have a Lyme disease, NICE are the people in charge of everything that doctors do in this country. So we now have a NICE Lyme disease guideline, which a GP can refer to if they're not sure, because they're not going to see Lyme disease in their surgery every day. It might be the first case they've ever seen. So there's a guideline for your GP if you find yourself in this position and the GP's a bit, I haven't seen this before, to refer to. So the first course of antibiotics is for 21 days, and the doctor can consider a second course of antibiotics for another 21 days if the person is still symptomatic after the first course. There is no test that we can use to see if Lyme disease is cured after the antibiotics, because as I said previously, the only test we have is an antibody test. So once you've made antibodies for any disease, not just Lyme disease, those antibodies will stay in your bloodstream for months, years, maybe forever. So it's no good having the antibiotics and doing another blood test, because you'll just find the same antibodies. So when we finally find a test that tests for direct action in active infection, and then we'll have a true test of whether that infection is current or active or not. So it's quite complex, but with the right information, you can discuss with your doctor and point them in the right direction. So this is a slide I mentioned on our website. I won't go through the whole thing because we all know about COVID now, but it is on our website, and there are some succinct differences between COVID and Lyme disease, but that's on our website. So if anybody's worried about that, they can have a look. So the resources I've mentioned, our website is lymediseaseuk.com. There's absolutely tons of information if you're worried about anything to do with Lyme disease on there. I mentioned the Lyme disease guideline, which a doctor can refer to, the NICE guidance, the Royal College of GPs put together with one of the other charities, a Lyme disease toolkit. That contains just about everything your GP would need to know. So there's two excellent resources there, because we commonly find that people go to their GP and the GP's like, I've never dealt with this before, I'm really not sure. So those resources, websites, all on our website addresses, all on our website. So you can refer your doctor to them if you find yourself in this position. So, and just say thank you for listening today, and thank you for your organisation for giving our charity a donation. We don't have any government funding at all, and most of the people who work for Lyme Disease UK are volunteers, as I am. And if any of you are marathon runners and anything else where you can raise some funds, you're very welcome to get in touch with us and think of us. So yeah, thank you for listening. So I'll just come out of there. And if anybody has any questions, I'm happy to answer. If you've got time, because I know it's your lunch, I'm happy to answer any questions.
Yeah, I've got a question. Does everyone that gets bitten by an infected tick get infected? Is there any natural immunity, or is there any sort of resistance to it?
No, I suppose it's a bacterial infection. So you can, bacterial infections are, if you cut yourself and you get bacteria and you get a bacterial infection. Some people's immune system seems to handle it better. We don't know why. But if you get bitten by an infected tick, you're likely to get Lyme disease. Okay. But a tick bite per se doesn't say you will get Lyme disease, because there's a big percentage of them not carrying the infection. But generally, if you get bitten by an infected tick, your immune system, if it's very strong, might fight the symptoms for a while. Some people's immune systems are stronger, but the illness will show in the end.
Okay. That's great, thanks.
I don't know if anybody else would like any questions. Oh, hey, Gabe, on the bottom. Just look in the chat box. So Barry wants to know, what is the maximum length of time approximately a tick can live on the human body? Well, when they embed and feed, they can actually, if you don't spot them and they happily feed in a way, they can stay on your body for 3 to 5 days. And I've known people who have found them and they've been in the countryside, 3 or 4 days before, and they've only just found them. But once they're fed completely, they will just drop off. And if you've missed it, you haven't spotted it, that's where, if it is an infected tick, things can become complicated because you've no idea that you've been bitten. And that's actually what happened to me. Yeah, but they can live on your body for at least 3 days, feeding quite happily, or even longer. Any more in the chat box at the bottom? If anybody wants to put anything in there, I can read those out.
How long do you have before it's too late to notice it or to realize? Because we are talking about a bullseye marking potentially taking 3 months to appear.
Yeah, so that's what makes things that can be difficult, because if the rash doesn't appear for quite a long time, you don't really realize what you were doing 3 months ago, and the bacteria's had time to sort of have a little travel around your body. But there isn't a set time when you've got to be treated by. The thing to keep in mind is, as soon as you notice any symptoms, get some medical advice so you can get some antibiotics into you. If you get an erythema migrans rash, at 3 months, it's still, it's not too late, put it that way. Get the antibiotics ASAP. It's really people like me who missed it completely. Considering I was a senior nurse, I had absolutely no idea about Lyme disease, and it was quite a while ago, where perhaps we didn't have the awareness we have now. I had no idea I'd been bitten. It was early spring, early May time, when you do, the ticks are like nymphs. I had absolutely no idea been bitten. And actually, for me, I felt a bit ropey in July and didn't know why. And then by October, I was really ill, but I didn't produce a rash or anything. So by October, I suppose the bacteria had sort of traveled a bit round, and yeah, I was really ill. I had no idea, but there wasn't the awareness when that happened to me. And the whole point of doing these sort of talks to organisations is to give people the information that I didn't have.
Hey, Julia. You mentioned specifically that dogs can contract Lyme disease. Can cats also contract it as well? I'm aware that they are more voracious groomers, so they're less likely to actually get a tick biting into them. But can they contract the disease if they do get a tick bite?
It's a really interesting question, because cats don't get Lyme disease. So there is a research project right there, because humans and dogs do, and cats can pick up ticks. You're right, they're really good groomers, so they're not as likely to have a tick on them for a long time. But that is one piece of research that needs to be done. Why don't cats get it? But dogs do. And if there are dog owners listening here, the vets are really clued up about Lyme disease. We need the vets to maybe have a chat to our medical professionals, because they're a bit behind the vets.
Thank you very much.
Anybody else?
Yeah, I think I know the answer to this question, but are there any programs similar to malaria and mosquitoes that are looking to eliminate the Borrelia bacteria from the tick population? Anything that can be done?
Yeah, I mean, there is research going on. It needs far more research, because in the bigger picture, in the wider picture, the bacteria that causes Lyme disease was only identified in the 1970s. So that makes it a fairly new illness, doesn't it, really? You know, it needs far more research into ticks themselves, like you said, why some people become very ill, why some people recover straight away after the first course of antibiotics, why some people go on to have longer term symptoms. There's so much research, but at the moment there's an organisation, it's the Brennan Laboratories at Glasgow University, and they're doing a project called What Makes Viruses Tick, even though Lyme disease isn't virus, so that's a bit, if you have a look at their work, they're actually doing exactly what you just said. They're looking at everything tick, why they carry this, how they do this, how they, you know, because they're really interesting creatures, because they've designed themselves that you don't feel them biting. You know, they'll hide somewhere warm so that you don't know. So the Brennan lab that's linked to Glasgow University, if you have a look at if you Google what makes viruses tick, they're looking at everything ecological wise. And of course, there's other countries doing stuff, but for the actual disease itself, needs far more research. And we need that elusive test for active infection rather than just an antibody test, which can produce a false positive and false negative results for various reasons. So, we hope, while we're waiting for that research, because research never happens quickly, does it? That, information like this will prevent people like me who were completely oblivious to it and then, really became very, very ill. And to be honest, nobody had a clue what was wrong. I mean, literally nobody. And it took me, let me think, count up. It took me 16 years to get to the bottom of it. It's a long time. And but if I had had this information back in, so when was it? 1999, probably wouldn't be sitting here doing this now. So yeah, do look them up because it's really interesting, the work they're doing.
Good, thank you.
Are we all done? I think so. I'd just like to say thank you to Megan for organising, and I hope that it was interesting. I mean, it's not the greatest lunchtime entertainment talking about a disease, but it is essential that people, are aware and know how to prevent this disease. Or if, they're unlucky enough not to prevent it, know where to go for help, what to look for. So, thank you for everybody for giving up your lunch. And if anybody does have any questions that they think of, Megan can always ping them over to me. So I'll just end the session for now. Thanks for attending. Thanks.
Thanks
Bye.
for all the great
Thank you.
information.
Thank you.
Thank you.
Bye.
Bye-bye.
Thank you. Bye.